Luke Johnson, Resin Video, attempt take 2. Hi guys. I thought about wearing a nose and mustache and glasses and speaking in a funny accent while doing this, but then I wondered if it would offend somebody. Which brings me to my first point. Know when you're being recorded. My second point is more practical and about dermatology medications. Please do not be afraid of the following medications when it comes to children. Triamcinolone 0.1% ointment, methotrexate, cyclosporin, and propranolol. If you don't feel comfortable using those medications on children, that brings me to my third point, which is that you're not alone in this. Please feel free to contact us, your former faculty, if you have questions about anything and think we could still be helpful for you. Feel free to contact your former co-residents, other people in your practice, or other faculty members wherever you end up. I certainly contact faculty from my former residency program and fellowship, and definitely make a lot of requests of the faculty here to help me out when I have something that I'm wondering about. And finally, my special bonus point is, if you would like to stay up on the dermatologic literature, podcasts are a great way to do it. Are we done?
Good morning, graduates. First, let me add my congratulations, my heartfelt congratulations to the list of people who will be congratulating you today on the wonderful, thoughtful, remarkable physician that you have become, as well as the wonderfully beautiful and strong women that you are. I know for me personally, it's been a joy to grow with each of you as a new mom throughout the course of your training. I will never forget Margaret, hunting through the Huntsman Cancer Institute to find crackers for me while I had really bad morning sickness on rounds, or Grace and Eloise coming to Sammy's first birthday party. It's just something that has been just such a joy to share with each of you, and you will be so truly and deeply missed. My clinical pearl for you today is one that I've learned, which is that your mentors are not going to stop being your mentors when you walk out those doors today. One of the greatest privileges of my career thus far has been the ability to reach back to those people that have shaped me through my training at different places, for their advice, their guidance, their support. It has truly enriched the person I am, as well as the new mentors that I've established here at the U. And so I would encourage you, as you move on to the next step, we are, for those of us who, are mentoring you here, are still here, we still want to be a source of support for you and a resource, whether it be for patient questions, for life advice, just for anything. I just want you to leave here knowing that you have the biggest fan base still here for you, and we're continued to be dedicated to helping you develop and grow. So I'm so excited to hear all of your stories from all of the patients you're going to see, and I'm just so excited for the patient populations that you guys are going to serve. They're truly getting a wonderful gem of a physician. So congratulations on just a wonderful accomplishment in this momentous day.
Congratulations to our graduating residents. You worked hard. I appreciate the chance to share a couple of pearls. Remember that patients will forgive you if you are running behind, but they won't forgive you if you rush when you're in the room with them, or if you cut them off when they try to talk. If you're chronically running behind, you're probably seeing too many patients. It's okay to see the right number for you. You'll be happier, your patients will be happier, and there'll be less burnout. Remember, when all else fails, treat your patients the way you wish or would like other doctors to treat your family members, and you'll do great. Do not, under any circumstances, ever attempt to cut a lipoma out of someone's scalp. It will only end in pain and suffering for everyone. Having money often makes life easier, but meaningful relationships make life happier. Again, congrats. Well done.
Caitlin, Chloe, Grace, and Margaret, congratulations. It has been so awesome getting to know the four of you over the past year and a half, and I am super excited for your futures. My pearl is to remember personal things about your patients. During a typical day, you're going to be seeing 20 to 40 patients and shooting the breeze with all of them. And at the end of the day, it's going to be really hard to keep straight who said what. So my tip is train your MAs to write down all the stuff you talk about with your patients, where they grew up, what they did for a living, how many grandkids they have. They can write it in the social history, and then you can paste it somewhere else into their chart. And then the next time you see them, you can ask them about their three-legged dog or their granddaughter who cheers for East High, and they will love you for it, and they will remember that you remember those things, and you're going to be awesome. And I'm so excited for you guys. Congratulations.
Congratulations to our graduating residents. It has been a pleasure to work with you in clinic and on call, and I'm so excited for your next stages. Just a couple of pieces of advice. You all, from my talks to you, know my passions are trying to treat your patients like you would want a doctor to treat your family members. Nothing opens your eyes more to how our health system works than being a patient on the other side. So just try to look after your patients. I use GoodRx every single day in clinic to get an idea of how much patients may be out financially for a medication I may be prescribing for them. I've decided that before I do any procedure that may not be a slam dunk, like freezing a wart, I need to know if that patient's got a high deductible insurance, because they don't want to get a bill for several $100s for something that may or may not work for that wart. Stay true to yourself, maintain your integrity, and don't let comparison be the thief of joy for you. Good luck in your next stages of life.
Caitlin, Grace, Margaret, and Chloe, it has been a true privilege taking part in your training. I have no doubt you will all be super successful in your practices. However, we all know that things won't go perfectly smoothly, even in the best field in medicine. And so when you're faced with a tough choice, whether it be clinical decision making, an ethical dilemma, whatever it may be, take a deep breath, take a few minutes, and reach out to someone who is truly interested in your success, as well as the welfare of your patients. There are a lot of those people around here. Congratulations.
To Caitlin, Grace, Margaret, and Chloe, number one, thank you for being wonderful residents. Thank you for coming to the University of Utah. My clinical pearls. One pearl comes from a man who used to be the OBGYN of a lot of the movie stars back in the old days, probably in the 1940s and 50s. And he was so well respected, and he spoke with me one time. It was long before I even went to medical school, and I was even thinking about it. And he said, whatever you do, treat everyone as if they're going to pay you $1,000. $1,000 from the 1940s correlates today probably 10,000 or so. In other words, treat everyone like they're just going to take good care of you. And number two, give everyone hope. That's one thing patients need, is they need hope, because they've often been through many providers before they get to your clinic, and they need to have a little something to feel like they're going to get better. And often that means you've got to do extra work and try extra things to get them better, but give everyone hope. Good luck, you guys. Thanks for all you did. Bye.
Learn new skills outside of medicine. I'm learning.
Chloe, Grace, Caitlin, and Margaret, congratulations. You have very successfully completed your residency in what has arguably been one of the most challenging times in medicine in many years. The excellence of your accomplishments during this time is something that you should be very proud of. It has been truly a joy and an honor to have been one of your attendings. You got stuck, some of you, Grace and Chloe, for not 1 but 2 years of having to listen to my pearls every Monday afternoon. So I am not going to throw more of them at you, with the exception of saying that You will never regret staying connected with one another, nor with any of your teachers or mentors from the past. So stay in touch. Congratulations, you have the brightest of futures ahead of you.
Hey guys, congratulations Caitlin, Grace, Chloe, Margaret on completion of 3 years, 3 really good years. Thank you for leading your colleagues really well. It's been a real privilege working with each of you. In terms of the wisdom part, I've been thinking about this, and I think that what I'd like to say is that I really hope that you have taken something away, something useful away from our interactions over the years. As opposed to the things that I've done being a warning to you in some way, for example. Anyway, I'm glad to have played a part in your education and wish you well in your future endeavors. And as my 97-year-old father has modeled so well for me in the past and continues to do so, live your life with balance. Congratulations.
Hi, graduating residents. I just wanted to take a moment and say how excited I am for all of you starting off on your careers. You're obviously all going to be amazing doctors, and it has been so lovely working with you for the past 3 years. We were asked to offer some words of advice, and I just thought I would give you one tidbit of advice, and that would be to treat each and every one of your patient visits as something important, and try to put yourself into their shoes and remember how you would feel in their position. A lot of times when patients come in, their problem may seem trivial to us, but to them it can seem like it's a very, very big deal. So just trying to understand where they're coming from, I think, can make a patient feel very good. And you are all very skilled at doing that already. So congratulations, it's been lovely working with you.
Be prepared for patient cancellations.
Extend congratulations to our graduating residents. It's been my distinct pleasure to supervise the PGY4 maternity clinic for this past year. I don't think we have ever been more prolific and more prolific year for babies than we have this year. I was concerned that Dr. Zone had reinstituted his role as Santa at the Christmas party, but then that's another story. I've come to each clinic ready to assist in the management of 3 pregnancies. Fortunately, I was limited to celebrating the birth of 2 beautiful baby girls, with another child due in August. All 3 physicians in Mid-Valley are not only excellent dermatologists, but also dedicated mothers. I'm impressed with the superb patient care all 3 have provided. They have demonstrated outstanding recognition skills as part of routine skin exams, and have provided inpatient care at 5 hospitals, something unusual for all residency programs in the country, and as part of that have demonstrated excellence in management of very complex medical dermatology. Margaret even has elected to become an expert in the diagnosis and care of difficult female dermatology issues, something that we have lacked in our department. All 3 seem well prepared to crush the boards and then accept the responsibility of caring for patients in private practice as well as academics. They will become an excellent resource for physicians seeking well-trained dermatologists for referrals. I certainly send my best wishes for their success.
Congratulations. I'm so happy for you. I'm so happy that I was a part of these last 3 years with you, and I look forward to seeing what you do. I also just want to wish that you're always able to find joy in your career.
Congratulations, Caitlin, Grace, Margaret, and Chloe. I don't have clinical pearls this time. I'll do 3, I don't know, maybe personal words of wisdom. Starting with ask for help when you want it or need it. Lean on your friends when you do. You should turn the camera and face you now.
Oh,
Turn the camera.
I did.
You
That's
did.
me.
Did you say
I'm
hi?
here. Hi.
Are you back to me?
Yes.
And then listen to music on your way to work. And if I could be super prescriptive, I would say start with Patty Griffin, Heavenly Day. Okay, congratulations.
Hi, Margaret, Caitlin, Chloe, and Grace.
I was looking for inspiration for your graduation message, and what better place than Central Park, New York, in front of the plaza, which leads me to your first tip. Travel for your CME. You'll see great places, meet new people, and learn a lot of great things. Number 2, use your dermoscopy skills that you've learned over the last 3 years. I promise they won't slow you down in clinic. And number 3, find your own work-life balance. Congratulations, you all, on a great job in a tough 3 years, and good luck on your career. And remember, like everyone else said, we're always here for you. And I got to add in that clarinet in the background for free. Have a great day, you guys.
What's up, all you graduating skin squeezers? It's Tinks, the tool dude, coming at you with some more tips. Tip number 1, never be afraid to ask questions. Excuse me, what's the best kind of cheese to make raclette? Raclette. Tip number 2, don't forget to keep reading and evolve your practice. Because you want to get better with age, not worse. Tip number 3, after this long journey you've been on, don't forget to reward yourself. I think I deserve this. I deserve this. I definitely deserve this. Chloe, Caitlin, Grace, and Margaret, it's been a pleasure getting to know you and working with you. Congratulations, and enjoy the rest of your careers. And no matter what anybody tells you, the black and white cookie is a good cookie.
Residency graduation, take 12. Caitlin, Margaret, Chloe, and Grace, congratulations on your graduation from residency, and best wishes as you embark on your clinical careers. I want to thank you first for your patience with me as a new program director this year, and also your leadership as chief residents in the residency. You've been a ton of help, and I really appreciate all you've done for our residency this year. Regarding clinical pearls, be wary of lichen planus on the lower lip with pain out of proportion to exam or unilateral lesions not responding to treatments. That's often a sign of a squamous cell cancer and important to have those biopsied. Second, don't be afraid of nail surgery. For unexplained onychodystrophy, even without melanonychia, those need a biopsy, especially if it's one nail, to rule out cancers, including melanoma of the nail unit. And it's okay to use Lido with Epi for your digital blocks. Third, I agree with Dr. Eliason on his recommendations regarding management of lipomas on the scalp. And fourth, and most importantly, go the extra mile for your patients. Treat them like your family, and don't be afraid to take on tough cases. You're trained, you're ready for this, and your communities will appreciate it and value your commitment to this type of care. Please stay in touch, and I hope you remain involved in the residency in some capacity. I wish you the very best as you start your careers, and look forward to seeing what comes next. Billings and Salt Lake City are very fortunate to have two of you joining those communities. Caitlin and Chloe, I look forward to fly fishing the Bighorn someday in the near future. Congratulations and good luck.
Hi, Margaret, Caitlin, Chloe, and Grace. Congratulations on your graduation. We're so excited to call you graduates of the University of Utah Dermatology residency, and that you are forever part of our family. We're excited to celebrate this milestone today with you. I just wanted to share a couple of things that I wish I'd known as I left residency and went into practice. And some of those things are things that I really didn't appreciate maybe until the last 3 or 4 years. And that is that it's important to be a lifelong learner of dermatology, but more importantly, it's to be a learner also of skills like practice management, finance, leadership, negotiation, and how to have difficult conversations. I've left you a couple of resources on your desk because even though some people say these things are inborn, they're actually not. They're things you can learn. How to have a difficult conversation is something you can practice and that you can develop. And I hope that the books that I've provided are helpful to you. So the last thing I just want to say is that I know that it's been an incredibly difficult 3 years, truly unprecedented for residents. And I want to say thank you. Thank you so much for your poise, for your grace, for being incredible learners and teachers and leaders. You are already amazing leaders, and we are very grateful for that. So thank you. Congratulations and the best of luck in your new practices. Call anytime for anything, and best of luck.